Niacin Rda Niacin is a B vitamin that is produced and used by your body to convert food into energy. This helps keep the nervous system, gastrointestinal tract, and skin healthy. Niacin, vitamin B3, is often included in daily vitamins, but most people don't get enough niacin from the food they consume. Foods rich in niacin include yeast, milk, fish, meat, bread, and cereals. People use prescription niacin, neocore, niaspan, to control their cholesterol levels. The recommended daily allowance, RDA, of niacin for an adult male is 16 mg per day for adult women who are not pregnant, and 14 mg per day. This study on the oral use of nicotinic acid to treat specific conditions shows high cholesterol. Nicotinic acid is used to increase the concentration of high-density lipoprotein, HDL, cholesterol, the good cholesterol that helps in removing low-density lipoprotein, LDL, and bad cholesterol in your blood. Despite niacin's ability to increase HDL levels, studies show that niacin therapy was not associated with lower rates of mortality, myocardial infarction, or stroke. Niacin deficiency, pellagra. The nutrients associated with niacin are called niacinamide, which can be used to treat or prevent niacin deficiency. In this state, it is not a common practice in the United States. Niacin deficiency has been associated with congenital pathologies. Studies in mice have shown that niacin supplementation during pregnancy prevents birth defects. Research is needed to prove that such a thing is in the human body. Generally safe prescription niacin can be taken advantage of by people with high cholesterol who are unable to take statins or may not be able to maintain their cholesterol levels through statins, diet, and physical activity. You should not take a niacin prescription for high cholesterol if you are pregnant. When taken orally in appropriate amounts, RDA, niacin appears to be safe. Large doses of niacin available by prescription may be the cause. Severe redness of the skin in combination with dizziness, rapid heartbeat, itching, nausea and vomiting, lower abdominal pain, diarrhea, arthritis. Liver damage, diabetes mellitus. Serious side effects are likely to rely on getting 2,000 to 6,000 mg of niacin per day. If you think you may have an overdose of niacin, contact your doctor immediately. If you have liver disease, peptic ulcer disease, or severe low blood pressure, hypotension, you should not take large amounts of niacin. The superstructure has been linked to liver damage and may cause hypotension, and may also be a trigger for peptic ulcer disease. Taking niacin can also cause an increase in allergies, gallbladder diseases, and symptoms of certain thyroid diseases. If you have diabetes, it can interfere with your work in managing and controlling your blood sugar levels. Nicotinic acid is used with caution if you have a complex form of arthritis and gout. This can lead to excess uric acid in the blood, hyperuricemia, resulting in the risk of developing gout. If you are pregnant, you should not take a niacin prescription for high cholesterol. However, if necessary to prevent or treat a deficiency, nicotinic acid, or niacin, is likely to be safe to take during pregnancy and in women who are breastfed, when used at the recommended doses. Possible answers are: alcohol. Taking niacin with alcohol significantly increases the risk of liver damage and reduces the side effects of niacin, such as redness and itching of the skin. Allopurinol, xylopram. If you take niacin and gout, and you can use more of them, medications from the bottom to take control of your arthritis. Anti-coagulant and anti-platelet medications, herbs, and dietary supplements. These types of medications, herbs, and dietary supplements reduce blood clotting. Taking niacin with them may increase the risk of bleeding. Blood pressure medications, herbs, and dietary supplements. This can be an additive effect when you take blood pressure medications, herbs, or supplements. This can increase the risk of low blood pressure, hypotension. Chrome finish. Taking niacin, chromium could lower your blood sugar levels. If you have diabetes and you take niacin, chromium, you need to carefully monitor your blood sugar levels. A cure for diabetes. If you have diabetes, this may affect the functioning of your blood sugar management and control systems. You may need to change the dose of your diabetes medicine. Drugs that damage the liver.